I told you that you could treat 260 babies a year from an old, damaged room, babies who are probably destined to die, would you believe me? It sounds improbable, and yet that is what we did with Une Chance de Vivre. My name is Micha. For the past 15 years, I work as a nurse. I mostly work in pediatric hospital. First in Paris, then in Montreal, Canada, specifically at the Children's Hospital. I was born and raised in France, but my parents are Congolese immigrants. Since I was a child, my mother has always insisted that I was lucky to live in France, but that I should not forget where my family came from and the importance of giving back to others. Because of that, I developed a strong interest in global health. And when I became a nurse, I participated in volunteer mission in low-income countries. And I have a master's degree in global health. Since 2016, I've been the CEO of a non-profit organization called Une Chance de Vivre, which means a chance to live. Together with 3 other nurses, Cynthia, Mariam, and Stephanie, as well as the late Dr. Baumier, we set up this organization. All of us have extensive experience in neonatal intensive care. Our main mission is to promote and develop maternal and neonatal health care in low-income countries. We believe that pregnant women and newborns should not be overlooked, and this is especially true in the most vulnerable communities. Quality care must be accessible to all of them, and in order to do that, we provide training and materials to healthcare professionals. We mainly work in the Democratic Republic of Congo, DRC, an African country with an estimated population of just over 100 million people. The poverty level in DRC is high. According to the World Bank, in 2020, 78% of the population live on less than $1.9 per day. As we can see on the screen, the maternal mortality rate in DRC is higher than the African average and well above the global average. Also, according to the WHO, the leading cause of death in DRC was condition neonatal in 2019. As I told you initially, my family comes from the DRC. So when I was young, I hear my mother and other women talking about the challenges of pregnancy and childbirth in DRC. But it was only when I met Eden, a young mother, that I fully understood the extent of these challenges. I was in the DRC, in a public hospital, with a midwife, and we have to assist Eden and her baby. Few hours earlier, Eden had given birth at a nearby private clinic, but there were complications, and she lost a lot of blood, and her baby also was very pale. Under the 35-degree heat, this young mother, her baby, and the grandmother had to walk for nearly 30 minutes to seek care that the private clinic could not provide. Eden decided to have her baby at the private clinic because at this time, it was less expensive than the public hospital. This experience perfectly highlights the challenges faced by babies and mothers in DRC. In 2017, a group of healthcare professionals from Kimbangi's Hospital of Kinshasa reached out to us. This hospital served as the main healthcare facility for Kimbanseke, the most densely populated and one of the poorest areas in Kinshasa, the capital of the DRC. The caregiver wanted to set up a neonatal care unit at their hospital. Since there was no neonatal care unit, sick newborns had to be moved from the maternity unit, and with no ambulance available, families had to transport the baby to the nearest neonatal unit on their own. This was difficult because they often had to rely on public transport or walking. In addition, it was uncertain if the baby received timely treatment or if they survived once they left the hospital. Given these circumstances, the project was definitely justified. Together with the local team, we established the objective and the step for creating the neonatal unit. Our goal was to do this project in collaboration with the local team, without adopting a colonizing approach, and to ensure that the unit meets the community needs. In January 2020, the neonatal unit starts. Our team trained the healthcare staff, and we supplied the basic equipment for the unit. Do you remember at the beginning of my speech, I told you about an old damaged room? This was the room that you use to install the neonatal unit after a bit of work and a good cleaning. At the beginning, the unit have 5 to 6 beds and carried for newborn from 35 weeks of gestational age. It was a really basic unit, but it worked well, especially with the admission kit that we put in place. To understand the significant role of the admission kit, it's important to note that at that time, universal health coverage was not available in DRC. This meant that in order to receive care, patient families had to purchase all the essential equipment. Insufficient money during this time resulted in a lack of care, leading to dramatic situations, including death. We saw it ourselves with Dr. Bomier at a hospital in Kinshasa. A newborn appeared to have a neonatal infection. Let me show you the video. As we can see on the video, the baby looked very pale and is very hypotonic and not responsive to the stimuli, and he started to have some sign of rest distress. The day before, the dad had brought the baby to the hospital. After the examination, the dad still have to buy all the essential equipment and medication before treatment could begin. Sadly, after receiving the list, the dad did not return, likely due to financial difficulties. As a result, the healthcare team was unable to start treatment, leading to a further deterioration of the child's condition. To prevent this kind of situation and start care without delay, we established the system of admission kit in our neonatal unit. Every patient admitted to the unit received all the essential equipment at no cost to start their treatment. Each admission kit had a value of $25, which greatly improved patient management. Being a small organization working in the DRC had many obstacles, which made it very difficult to find funding. However, our families, friends, co-workers trusted us and made significant contribution to fund almost 600 admission kits. We face these difficulties, such as the COVID pandemic with the travel restriction. We have to find another way to support the local team during this period. Despite all of that, the neonatal unit was functioning well, and we gained the trust of a large donor. Therefore, in 2023, we decided to move on the phase 2 of the project, which aimed to expand the capacity of the unit to 10 beds and take in newborn as of 32-week gestational age. This phase was supported by a donation of more advanced and updated equipment. I am not going to lie to you. Getting this equipment delivered was quite challenging. Dealing with customs, bad rules, hospital poor facility, as well as the unstable electricity made it difficult. However, we managed to do it. The new equipment improved the quality of care. Additionally, the DRC has achieved universal health coverage. So now, the government will now pay for the care of mothers and newborns in certain hospitals in Kinshasa. Thanks to the work we did with this neonatal unit, it's now part of the universal health coverage. Our main challenge now is to make sure that the neonatal unit and the skill acquired can be maintained. Most caregivers have never used advanced equipment before. So working in this condition, it's a new experience for them. So that's why, besides providing an on-site support, we are developing an online platform protocol. This platform for caregivers will offer guidance on neonatal care. This platform will also be available to all healthcare professionals across the DRC. We started our commitment with very little, but to focus effort, we managed to assist many mothers and their baby who initially faced a difficult start in life. Since its opening, the neonatal unit at the Hospital Kimbangis of Kinshasa has admitted nearly 1,006 newborns. For this project, our team trained 15 doctors and 30 nurses. Beyond establishing the neonatal unit, this project has also highlighted the challenges faced by a community that had previously been overlooked. While I stand before you today to speak about this achievement, it's important to recognize that this project is the result of a collective effort. It would be never started without the vision, dedication, and the determination of the remarkable local team. And I want to thank them today. Today, we are extending our effort to other regions of the Congo and to other low-income countries. To sustain and extend our commitment, we rely on continuous support and collaboration. Partnership is essential in helping us make a lasting difference. Despite all challenges, we remain strong in our commitment. We are exploring innovative solutions to reduce the cost and increase the efficiency, including the use of telemedicine and remote training programs. It's about finding a way to make every dollar count so that more babies can be saved and less families experience the pain of losing a child. If you want to know more about us and what we do, don't hesitate to reach out to us through our website or connect with us on social media. Thank you so much for your attention.